MPs say no to finding out how much pain cuts are really causing. The Commons has rejected demands for a cumulative impact assessment on changes to benefits. Indeed, many MPs found the debate so unimportant that they could not be bothered to listen or take part, and they just turned up to vote at the end. Currently, the government assesses how a policy change affects people by carrying out a one-off impact assessment, and ministers claim this is all that is necessary. But many people receive more than one benefit at a time. You get a small sum for being in poor health, another for being unemployed, another if you have a child, another if you have a high housing costs, and so on. Also, there isn't a single benefit that hasn't been cut or scrapped or made harder to get. These two facts combined mean that almost everyone receiving benefits will be affected by more than one cut. For disabled people, this multiple cut effect is even more significant, as they are far more likely to rely on several benefits to make up their income, due to their disability and their higher risk of being unemployed or on a low income. There are hundreds of thousands of disabled people facing 4, 5, even 6 separate cuts to the benefits they receive. The government has no idea how cuts are impacting on disabled people and no intention of measuring. Claudia Wood, Deputy Director of the think tank Demos, wrote an article for The Independent on why a cumulative impact assessment was essential to understand the real effects of benefit cuts. It was published on the 10th of July, the day that MPs voted against doing any such thing. The Independent's headline said it all. On the 10th of July, Labour used its Opposition Day debate to focus on the impact of the government's welfare reforms on disabled people. Shadow Minister Liam Byrne demanded a cumulative impact assessment of its changes to benefits. But if the government carried out a cumulative impact assessment, each of its welfare cuts would get a much-needed reality check. Currently, the government assesses how a policy change affects people by carrying out a one-off impact assessment. So when the so-called bedroom tax was drafted, ministers knew roughly how many people would lose out and by how much per week. Similarly, when disability living allowance was replaced with personal independence payment, the impact assessment showed how many DLA claimants would not be entitled to PIP and how much income they would lose as a result. But many people receive more than one benefit at a time. You get a small sum for being in poor health, another for being unemployed, another if you have a child, another if you have high housing costs, and so on. The second is that the government's ambition around welfare reform knows no bounds. There isn't a single benefit that hasn't been cut or scrapped or made harder to get. These two facts combined mean that almost everyone receiving benefits will be affected by more than one cut. For disabled people, this multiple cut effect is even more significant, as they are far more likely to rely on several benefits to make up their income due to their disability and their higher risk of being unemployed or on a low income. There are hundreds of thousands of disabled people across the country facing 4, 5, even 6 separate cuts to benefits they receive, as the government makes sweeping reductions to welfare spending. This is why a cumulative impact assessment is so important. At the moment, the government has no way of knowing how much that disabled person facing 6 cuts stands to lose. They know how many people are affected by each separate cut, but have no idea how these might hit one individual or the impact the combined cuts might have on a family's budget. The government says a cumulative impact assessment is too difficult to carry out, but Demos, with the support of Scope, carried out its own cumulative assessments with readily available public data, and the results are striking. A total of 264,000 disabled people in social housing will lose in total over £6,300 each by 2017. Households facing a combination of 6 simultaneous cuts are to lose £4,600 a year. For disabled people, these are life-changing, life-endangering losses. They often have higher living costs, taking taxis when public transport is inaccessible, spending on more heating and specialist food, and having to buy specialist clothing. The list is endless. For those surviving on benefits, bear in mind half of disabled people in this country are unemployed. Losing £10 a week makes heating, electricity, rent, life-saving equipment, or a medical appointment too much to cover, and something has to give. Disabled families we spoke to during our 2-year disability and austerity study showed us clearly what that meant. For the parents of a disabled child, it meant skipping medical appointments because they couldn't afford the diesel. For a disabled man and his wife caring for him, it meant stuffing the window with newspaper in the winter because they couldn't afford the repair. For a young woman in a wheelchair, it meant getting further into debt when a tyre needed replacing. The government cannot persist with the piecemeal analysis currently used to estimate the impact of welfare reform, which measures only one cut at a time. Without a cumulative analysis, we have no way of knowing who is worst affected and by how much. How can we judge the fairness of cuts without knowing their impact? This is an abridged version taken from The Independent from the 10th of July 2013.